If you've been calling yourself lazy because you're exhausted, pause for a second. Fatigue isn't a personality flaw, and sometimes it's a simple biology problem, like low iron. Iron helps your body make hemoglobin, the protein in red blood cells that carries oxygen. When iron is low, you can feel like you're running on low battery, even after a full night of sleep. And the tricky part is that it can look like stress, burnout, or just being out of shape. In this video, you'll learn the most common warning signs that your fatigue might be tied to low iron, plus a few less obvious clues people miss. We'll also talk about who's at higher risk, what to ask your clinician to test, and how to support iron levels with food in a realistic way. The goal is not self-diagnosis. It's to help you recognize patterns so you can get the right workup sooner. Moving to slide 2. Here's the core idea. Low iron can reduce oxygen delivery, and your body responds by conserving energy. You may notice you tire out faster, your heart works harder, and your brain feels foggier. There are two related terms people mix up. Iron deficiency means your iron stores are low, often measured by ferritin. Anemia means your red blood cell levels or hemoglobin are low. You can have low iron stores before you become anemic, and you can feel symptoms in that stage. That's why some people get told their blood count is normal and still feel awful. Iron status is also affected by inflammation, infections, and chronic conditions, which can complicate lab interpretation. So instead of focusing on one number, it helps to look at the whole picture: symptoms, risk factors, and a full iron panel when appropriate. That's the mindset for the rest of this video. Moving to slide 3. The most common sign is a specific kind of tired. You feel drained in a way that rest doesn't fully fix. It's not just sleepy. It can feel like your muscles have no fuel, like simple tasks take extra effort. You might wake up and already feel behind. You may also notice that your stamina drops. Walking upstairs, carrying groceries, or a normal workout suddenly feels harder. Some people describe it as getting winded too easily, even when their fitness hasn't changed much. This happens because when oxygen transport is limited, your body shifts into energy-saving mode. You might also become less active without meaning to, which can then look like I'm unmotivated. Pay attention to the pattern. If fatigue is persistent, out of proportion, and paired with other signs we'll cover, low iron becomes a reasonable question to explore with a clinician. Moving to slide 4. Another clue is brain-related: trouble focusing, slower thinking, and that cotton in the head feeling. Iron is involved in how your brain uses oxygen and supports neurotransmitter function. When iron is low, concentration can feel fragile. You might reread the same paragraph, lose your train of thought, or feel mentally tapped out earlier in the day. This can be especially confusing because it overlaps with anxiety, depression, ADHD, and sleep problems. The difference is that with low iron, the mental fog often comes with physical signs too, like low stamina, headaches, or feeling cold. Some people also notice irritability because when you're running on low energy, small stressors hit harder. If you've been blaming yourself for not being disciplined, it can help to reframe it as a capacity issue. Your brain may be asking for better oxygen delivery and better iron status. Moving to slide 5. Let's talk about shortness of breath and a racing heart. When oxygen delivery is less efficient, your body may compensate by increasing heart rate. You might notice your pulse jumps with mild activity, or you feel your heart pounding when climbing stairs. Some people feel lightheaded when standing up quickly. Others notice they get breathless during conversations while walking, even at a normal pace. This doesn't automatically mean low iron. Heart, lung, thyroid, and anxiety causes are also possible. But it is a classic pattern in iron deficiency and anemia. One simple self-observation is whether your exertion feels disproportionate to the effort. If you're doing the same activity you used to do, but your body reacts like it's a sprint, that's information worth bringing to a medical visit, especially if it's paired with fatigue that's been lingering for weeks or months. Moving to slide 6. Cold hands and feet can be another sign people brush off. If iron is low, oxygen delivery and overall energy production can drop, and some people feel chilled more easily. You might be the person wearing a sweater when everyone else is fine. You may notice cold fingers, cold toes, or feeling cold after meals or at the end of the day. Pallor can also show up. Your skin may look paler than usual, or the inside of your lower eyelids may look less pink. These are subtle signs, and they're not perfectly reliable, especially across different skin tones, but they can add to the pattern. If you combine feeling cold with fatigue, brain fog, and reduced stamina, it's more suggestive than any one symptom alone. Think of these as supporting evidence that your body may not be transporting oxygen as efficiently as it should. Moving to slide 7. Headaches can also be part of the picture. When oxygen delivery is limited, some people develop frequent headaches or a dull, pressure-like feeling. You might notice headaches that come with exertion, long days, or when you're not sleeping great. Another related symptom is dizziness, especially when you stand up quickly or feeling a little unsteady in busy environments. Again, headaches have many causes, so the point is not to assume. The point is to notice clusters. If headaches are new, more frequent, or paired with fatigue and shortness of breath, it's worth discussing iron status as one possible contributor. Some people also report restless sleep or waking up unrefreshed. That can become a loop. Low energy makes sleep worse, and poor sleep makes fatigue worse. The practical takeaway is to track frequency and triggers for a couple of weeks so you can describe the pattern clearly at an appointment. Moving to slide 8. Now for some of the less obvious signs. Hair shedding, brittle nails, and strange cravings. Iron is used in many growth and repair processes. Some people notice increased hair shedding in the shower or brush, or hair that feels thinner over time. Nails can become weak, peel, or break easily. In more pronounced cases, nails can develop a spoon-like shape, though that's not common. Another classic clue is pica, craving non-food items like ice, clay, or starch. Craving ice, called pagophagia, is surprisingly associated with iron deficiency in some people. If you're chewing ice constantly, don't just label it a habit. It can be a signal. None of these prove low iron by themselves, but if they show up alongside fatigue and low stamina, they strengthen the case for checking iron stores, not just a basic blood count. Moving to slide 9. So who is most at risk? The biggest category is blood loss. Heavy menstrual bleeding is a common reason iron stores drop, even if it feels normal for you. Pregnancy and postpartum periods also raise iron needs. Another risk group is endurance athletes, because they can have increased iron turnover and losses through sweat and small amounts of GI bleeding. Diet matters too. If you eat little or no red meat, or follow a vegetarian or vegan pattern, you can still get enough iron. But it takes planning, because plant iron is absorbed less efficiently. Digestive issues can reduce absorption as well. Think celiac disease, inflammatory bowel disease, or chronic acid suppression therapy, which can affect stomach acidity. Frequent blood donation is another overlooked factor. If you recognize yourself in one or more of these groups and you have the symptoms we discussed, it's reasonable to bring up iron specifically at your next check-in. Moving to slide 10. If you're going to get checked, it helps to know what to ask for. A standard CBC can show anemia, but it can miss early iron deficiency. Many clinicians will add ferritin, which reflects stored iron, and sometimes serum iron, transferrin saturation, and total iron binding capacity. The exact panel varies, and interpretation depends on context. Ferritin can look normal or even high if you have inflammation, because it also behaves like an acute phase reactant. That's why symptoms and history matter. It's also smart to ask about other common fatigue labs, like thyroid function, B12, and vitamin D, depending on your situation. The goal is a thoughtful evaluation, not a shopping list of tests. When you talk to your clinician, describe your fatigue in functional terms, what you can't do anymore, how long it's been going on, and any bleeding history. Clear details speed up good decisions. Moving to slide 11. Let's cover food strategies that support healthy iron levels, because diet is a practical lever, whether or not you end up being deficient. There are two main types of iron in food. Heme iron, found in meat and seafood, is absorbed more efficiently. Non-heme iron, found in plants like beans, lentils, tofu, spinach, and fortified cereals, is more sensitive to blockers and boosters. A simple upgrade is pairing iron-rich foods with vitamin C, which can improve absorption. Think bell peppers with beans, citrus with leafy greens, or berries with fortified oatmeal. On the flip side, coffee and tea with meals can reduce absorption for some people, as can large amounts of calcium taken at the same time. You don't need to fear these foods. Just consider timing if iron is a concern. And if you're considering supplements, do that with medical guidance, because too much iron can be harmful for certain conditions. Moving to slide 12. Before we wrap up, here's the big picture. If your fatigue is persistent, affects your daily life, and comes with clues like low stamina, brain fog, breathlessness, feeling cold, headaches, or hair and nail changes, low iron is worth ruling out. The most helpful approach is to treat this like a pattern recognition problem, not a self-judgment problem. You're not trying to prove anything. You're trying to gather accurate information and bring it to a professional who can interpret it with labs and your history. If you want a simple next step, write down 3 things: your top 2 symptoms, how long they've been happening, and any risk factors like heavy periods, dietary pattern, endurance training, or blood donation. That makes your appointment more productive. If you found this useful, make sure to subscribe for more clear, evidence-informed health explainers. And for a quick check-in, comment with your experience. Have you ever had fatigue that turned out to be iron-related? Yes or no? This information is not a substitute for medical advice.